In today's video, we're going over slap, tear, treatment essentials. So slap tears are extremely common. They're actually going to be a little bit more common than rotator cuff pathology, to give you an idea just how common they are. They're also very, very common overhead athletes. And when I say overhead athletes, I'm talking about people who throw generally. So thinking about baseball players, baseball pitchers, javelin, football, right, quarterbacks, but also can be in tennis players because they serve, or in volleyball players because they're also serving and hitting overhead, right? If you have an athlete with a slap pathology that just likes traditional weight training, I recommend you treat them a lot like you would treat someone with rotator cuff related pain, as long as you have no instability, all right? And I have a lot of videos on that, so I'll leave a link in the description, in the show notes if you guys want to check that out. But in today's video, we're going to focus specifically on these overhead athletes using a baseball pitcher as a primary example. And we're going to use an article by Steinmetz in 2022. He goes over some basic treatment principles. So step number one is going to be reducing inflammation in your athletes. So the way we reduce inflammation is we back away from provocative activities. And this is usually throwing. But if you have a tennis athlete, maybe you're continuing to play tennis, but you're just not serving, okay? In this study, it was a systematic review, so there were 5 main studies they included. In some of those studies, they actually used corticosteroid injections or oral anti-inflammatories. Now, I'm not a big fan of using corticosteroids with athletes unless you absolutely need it. If you have a patient in the early stage of rehab and they're just making zero progress, then maybe send them back to the doctor for a corticosteroid or some oral anti-inflammatories. For the majority of patients, I would actually recommend just backing off of provocative activities. You'll find their pain just starts going down naturally. Step 2, we're going to restore pain-free range of motion. We say range of motion, which directions are going to be important? Well, for the thrower, it's going to be flexion, overhead motion, it's going to be external rotation, and internal rotation. The first motion we're going to look at is going to be flexion. I like to measure this in 2 different ways. So first, let's have you bring both arms fully overhead, Scap. Good, locking out those elbows. I just want to get an idea of how far we go from a range of motion perspective. I'll show you how to do this in a second with a goniometer. Now, if I let Scat's arm go fully overhead like so, we're actually measuring motion from the shoulder blade, as well as the lats and the shoulder joint. So there's a lot of things we're picking up on. If I want to be a little bit more specific to the shoulder joint, as well as the teres major, then I'll do what's called scap blocked flexion. So I take my hand and I block the scap so it doesn't move. From here, I'm not allowing the shoulder blade to move. I'm gonna go fully overhead, just like so. Right? So Scat actually has a ton of range of motion here, but generally speaking, when you block the scapula, you have less range overhead because you're not allowing the shoulder blade to move. So like I said, I like to do 2 measurements. We go arm fully overhead, just have to go all the way down here. And Catherine's gonna use our good old goniometer to measure this. So essentially, I like to have one arm straight along the side, okay? So basically you're going to be parallel with the floor. And the other side arm is just picking up on her flexibility in the shoulder. Now you'll see right here with Scat, she's tremendously flexible, so she's easily touching the table and it's actually blocking her range of motion, but obviously some folks are not gonna be quite that far. And when we perform this Scat block motion, let's have you bring this arm back up, and I'm gonna hop in here, Catherine. All right. So I'm going to pin the shoulder blade down. Sorry, Scat, digging underneath of there. Good. And then go fully overhead. I'm gonna make sure the shoulder blade doesn't move. And then when you measure with the goniometer, we're basically trying to have the goniometer along the border of the scapula, and we're measuring range of motion within the shoulder joint as well as the teres major. So you have an athlete with restricted overhead range of motion, we want to start working on the teres major and the lats, potentially a little bit within the shoulder joint. Just be careful, so folks that have slap tears often have instability, so we might not want to put as much focus on mobilizing the shoulder joint, right? Is that essentially we need to know what normal is, and the way we figure that out is by assessing the opposite side. So let's say Scat has 180 degrees on this side, we want the throwing side to be symmetrical if we can. Next, we want to measure external rotation as well as internal rotation. So have your patient lying on their back, you're going to take their elbow up to the same level as the shoulder. We want to be in the scapular plane, and from here, we're going to end range external rotation, and we'll measure this. I'll show you how to do this in a second. We also want to measure end range internal rotation. So I'm going to flip here. I'm going to hold on to the scapula with this hand. My thumb, goes on the coracoid process, relaxing the elbow here. I'm going to go end range internal rotation just like so. So measuring range of motion is pretty simple. I'm not in the right position because I'm trying to show you guys with the camera, but essentially we're gonna go into the same position, so 90-90 scapular plane, and from here, go into end range external rotation. And Catherine's gonna come in and measure that range. Yep, so vertical and then coming back. Generally speaking, you're gonna see 90+ degrees of external rotation. For baseball players, you're gonna see more, probably upwards of 120, 130 in some folks, and that's actually relatively normal for them. Internal rotation can be measured the same, so relax as best you can, Scat. I'm gonna go grab onto the scapula right here and go into end range internal rotation. Go ahead, Catherine, let's see what we got. Yep, how much we got there? 60 degrees. So this is more or less normal for the average person. Scat's actually more lax than the average person, so it's a little bit beyond that. But the other thing you will generally find is limited internal rotation, but excessive external rotation. So if you work with a lot of baseball players and you work with physicians that refer baseball players to you, you've undoubtedly heard a physician say, this patient has GIRD, you need to stretch into more internal rotation range of motion. However, this really isn't always the case. So as a thrower growing up, if you throw a lot of baseballs, if you're throwing or doing a lot of serving, if you're a tennis player, you'll probably have bony changes that are going to grant more external rotation and limit internal rotation range of motion. So if someone is limited with internal rotation, it doesn't mean they're tight. They could actually have excessive external range of motion. So if a physician tells you, stretch this tight shoulder, they're limited with internal rotation, but they have a crazy amount of external rotation, they're actually a looser individual, and I don't know if that's the best advice, right? Really what we're looking for is total arc range of motion, which is going to be internal rotation plus your external rotation. So essentially, we take Scat's arm, we measure the external rotation. Let's say this was around 100, and then we go into internal rotation, and this is around 60. Her total arc is going to be 160 degrees. And we want to assess the flexibility on the opposite side. And let's say on her non-throwing side, she has around 80 degrees, but she has, 80 degrees of external rotation, but also 80 degrees of internal rotation. So on the throwing side, she actually has a little more external rotation, a little less internal rotation, but it's identical to the opposite side. In that situation, that's good. You're gonna see baseball athletes have, let's say, 20 degrees of internal rotation range of motion, then they have 130 or 140 degrees of external rotation, and it's symmetrical to the opposite side. So in that case, the total arc is the same. Now, if someone has limited total arc, then yes, we wanna try and improve that. But keep in mind, just because they're limited in internal rotation doesn't mean you have to stretch them. For someone with limited external rotation, the muscles that are usually going to limit that are going to be the subscap, the pecs, a little bit of the lats, maybe a little bit of the teres major. For someone who's limited with internal rotation, it's usually the posterior cuff. Now the way we handle this for our throwing athletes at Champion, PT, and Performance is mainly through soft tissue mobility, maybe a little bit of stretching, but not very much. If you guys want to see the exact strategies I like to use, I'm going to leave a link in the show notes for my favorite soft tissue strategies, as well as manual techniques to improve mobility. So check that out there if you want a more in-depth guide. Step number 3 is restoring strength of the rotator cuff and the scapular muscles. Now, I'm not gonna go crazy with exercises. I'm just gonna give you a couple. I have a million videos about shoulder exercises to strengthen the shoulder. I'll leave a few links in the show notes if you guys wanna check that out. We're just gonna go over the basics, some of the most important ones. The most important exercise we start most athletes is going to be sideline external rotation. Most boring exercise of all time, maybe one of the most important. So have your athlete lying on their side, elbows can be glued to their side here. You can put a towel roll underneath the elbow if you want. And from here, hand starts in the belly. Go ahead and press up into my resistance up to here. Yep, all the way to the top, and then right back down again, right? Basic and easy, sideline external rotation. Another very easy, tried and true exercise is good old scaption. So we're gonna have thumb up, just like so. Some folks call this a full can, just because empty can, you're dumping everything out of the can. Full can, you're keeping it full, right? In terms of shoulder position, we're not way out into abduction. We're 30 degrees off into the scapular plane. Do you mind showing a few of these reps here? Thank you very much, Scat. You don't even have to go that high. I just stop at shoulder level and right back down to your side. Excellent. Some good scapular exercises are going to be a prone extension, or a T, and then a Y. So let's do a few prone extensions here. And what Scat is going to focus on is just bringing her hand up to her hip, but also bringing her shoulder blade a little bit back and together at the top. Yep, retracting fully at the top, reaching at the bottom. Let's show a few T's. And T is straight out to the side. Same idea, reaching down towards the floor, and at the top, retracting, bringing that shoulder blade back. Excellent. And then for the Y, thumb up, go ahead. Same idea, bring that shoulder blade back. Awesome job. It's also really important that we measure strength and make sure we're progressing our strength over the course of time and hitting some goals. So if you have a post-op ACL reconstruction, we talk all the time about how important it is to have symmetry within the quads, hamstrings, so on and so forth. Same thing goes in the shoulder. We actually have some data to support this as well. So I'll give you those exact numbers in a minute. First, I want to go over what we're measuring and how we measure it. So the three directions I think are most important are going to be external rotation, elbow at the side, internal rotation, same position, as well as scaption. Now this is what's called a handheld dynamometer. If your clinic doesn't have it, I would highly recommend it. This is called a Vald dynamo, but there's lots of different ones on the market. First direction we're going over is going to be external rotation. So I'm going to take this towel, roll it up, and put it underneath of the elbow, just like so. The reason why we do this is when we're measuring external rotation, we don't necessarily want our patient to be abducting, right? We want them to externally rotate. So the cue I give Scat here is to squeeze this towel as she rotates out, right? We also want Scat to have nice posture. We're gonna have her left side hand hold onto the table. We want her to be nice and stable. We also wanna have a good stance, so maybe a little bit wider with the feet. Make sure she can produce a bunch of force right here. If you notice when we're doing this handheld dynamometry test that your athlete is starting to lean to the side or they're starting to extend with their tricep, stop the test. Because we're not assessing external rotation strength anymore. We're assessing the tricep or the trunk, right? So essentially, I'm gonna take my handheld dynamometer, just like this, and I wanna make sure I'm very consistent from patient to patient and test to test by putting the handheld dynamometer basically right below the joint of the wrist right here. And then what I'm doing is I wanna be a statue. Essentially, I'm not trying to push into her whatsoever. She's gonna push into me, and I'm an immovable object, right? So essentially, I place this here, I get nice and strong and supportive, and then my cue is go ahead and push into me, right? And then take a breather. Usually you wanna make sure you give a warm up for your athletes. But when it's time to go, you actually want to yell at them a little bit. Because here's the thing, if you don't yell at your patient, there's a chance they don't push as hard as they could if you really yell at them some more, right? Obviously know your patient, don't start screaming obscenities at them, but it will amp them up a lot. We've certainly seen people gain 10, 15% more strength just by encouraging them. Maybe encouragement is the right word. So essentially we set up, good posture, go ahead and push against me, and then push, 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 and relax. Maybe a little annoying, but it's probably good to assess true strength. Next, we assess internal rotation, and the only thing that changes is my position. So as opposed to pushing out this way, we're pushing in. So I just have to flip as a clinician, right? So same exact technique. What we're gonna do is put your left hand down, grab onto the table, brace nice and hard, good tall posture, elbow glued to the side, and I'm gonna come in across, placing right below the wrist joint, and from here, I'm a statue. Go ahead and push into me. Push, 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 push. Take a breather. Obviously, write down the numbers, because those will be important in a minute. Next is going to be scaption. You can also measure abduction, but what I will say is that those measurements are very, very similar. So if you're a little strapped for time, I'll just take one or the other. So to assess for scaption, we just take the shoulder, and or the hand, and bring it to shoulder level. We're gonna come to 30 degrees into the scapular plane. Then I'm going to be the statue, the immovable wall, right, over the top. Make sure my placement is good, so right below the wrist. And then from here, go ahead and push up as strong as you can. Push, 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 and then relax. Good job, Scap. So you have a bunch of strength numbers. What the heck does this all mean, right? Well, we're looking for a few things. So for one, we're looking for symmetry between sides. So essentially, am I as strong on my throwing side as my non-throwing side? However, that's not perfect. You're working with throwers. Those guys are asymmetrical athletes. Although you do still want to shoot for symmetry. The other thing we're looking for is going to be prerequisite amount of external rotation strength. We're looking for around 15 to 20% of the athlete's body weight. So you have someone that's 200 pounds, we're looking for around 40 pounds of strength into external rotation. That would be 20% of the body weight. We're also looking for ratios. So pitchers over the course of a throwing season will often lose external rotation strength. So what you may find is a painful shoulder has really poor external rotation strength, but has really high internal rotation strength. And what we're looking for is around a 2 to 3 to 3 to 4 ratio of external rotation strength to internal rotation strength. So use the athlete from before, if we have around 40 degrees, 40 pounds of external rotation strength, we want to see around 60 pounds of internal rotation strength, right? The other piece is that you can start looking around at normative data. So I'll leave a link in the show notes to a study on normative data of shoulder strength in baseball pitchers, Major League Baseball, right? So if you're working with a population like Major League Baseball pitchers and you want to see what normal should be, we have some research to guide us. But you're going to have to snoop around the research on your own to see if there's normative data for, let's say, tennis players, swimmers, so on and so forth. You probably won't get normative data on every population, but you also don't need to have your 40-year-old parent having the same external rotation strength as a Major League Baseball pitcher, right? So make sure your normative data applies to the population you're seeing currently. Another piece of normative data that shouldn't be normal is that most folks that watch the Fitness Pain Free channel are not subscribed. You should probably subscribe. While you're at it, like it. The next key is that you want to train the entire chain. And in a few of these studies, the Steinmetz article that I mentioned previously, they use hip strengthening exercises as well as core strengthening exercises. They try to make those a little bit more specific to what an overhead athlete needs to do from a sports specificity standpoint. So a couple good exercises you can do are things like presses, rows, and general lower body strength training. One good exercise you can try is a single-legged deadlift. So essentially, let's have you stand on your left side leg, and then kettlebell is going to be in your right side hand, relaxing the arm straight down. We're going to go down like a regular deadlift, chest stays up, and reaching that opposite side leg back and right back up again. Excellent, looks great to me. In terms of core strengthening, you have a lot of options. One of which I like is just a traditional ab wheel. So essentially we're gonna have Scat here kneeling on a pad, hands on the ab wheel, reaching out as far as you control, and then come right back again. Let's go one more repetition. Notice how she's not moving much from her core here, coming right back, resisting that motion. Take a breather here, Scat. Also keep in mind that most overhead athletes are rotational athletes. They're producing force with their core rotating and flexing, right? So essentially we want to train things like ab wheels, which are also incorporating things like chopping exercises, as well as things like anti-rotation press, just making sure you're treating the athlete specifically for the activity they're trying to get back to. So you've got your pain-free range of motion, we rebuilt the strength, now I want to start to incorporate some plyometrics. And usually we start with two-handed plyometrics and progress to one-handed plyometrics. One of my favorite easy ones to start with is just a chest pass off the wall. She's gonna have Scat stand with an athletic stance, hips back slightly, and she's gonna dribble the ball against the wall just like so. Excellent. Once you spend a little bit of time, so maybe a few weeks, perfecting your double hand plyos, we start to progress to single arm plyos. One very easy one to do is just a 90-90 wall dribble. So let's have you face the wall here, Scat. Elbow up to shoulder level, hand against the wall, and go ahead and show me some dribbles. Excellent, that looks great. And as you progress and get a little stronger, you can go a little faster and harder against the wall, potentially use a heavier medicine ball. Now we don't want to neglect lower body plyometrics as well. When we're throwing, that power comes from the floor through the lower body core into the arm, and then you release the ball, right? So we make sure we're training the entire chain. Really easy exercise that kind of mimics the throwing motion is going to be a skater squat with a quarter turn. So go ahead and bounce on that right side leg, jump out towards me, Scat, and then land with two legs. Very good. So you can see how we're exploding off that backside leg and turning in a similar fashion to throwing, right? Now I'm not gonna go crazy with plyometric variations because we're gonna be filming a very extensive video on this. So keep your eyes peeled for that. But here's hopefully a couple ideas to get you started at least. So if you've gotten through all of these steps, the next thing to do is incorporate an interval throwing program. So if you're a baseball player, you're gonna slowly ramp up the amount of throws that you do and how hard you are throwing. And usually you start with an easy throw where you're pretty close to your partner, and you just extend that out over the course of time. And if you're a pitcher, maybe you have a mound progression. Now I am not an expert with return to throw programs, interval throwing programs, but I know someone who is. His name is Mike Reinhold. He's my boss, and he actually just published a really good paper in IGSBT 2024 that has an interval throwing program that he made. So I recommend checking that out, link in the show notes. And then if you've gotten through all of the steps at this point, so essentially pain-free range of motion, got your strength back, started doing your plyos, two hands and then one hand, and everything is going well, that's when you would start your interval throwing program. So how long does it take to go through all these stages? So in the Steinmetz article, the average person returned back to play at 5.5 months. And here's the thing, a lot of these people did not complete the entire rehab program, and the return to sport rate was around 50%, so not great. For the folks that completed all of these steps, they got back at around an 80% rate. So I would just urge you as a physical therapist not to skip steps and not to return too soon, because your outcome is probably a lot worse as opposed to going through all the steps. I know 5.5 months is a long time, but the worst thing that could happen, and we see this quite a bit, is folks go back too fast and they re-aggravate their shoulders. They're kind of back to square one, right? So to summarize, we're trying to restore pain-free range of motion, restore the strength, slowly introduce plyometrics. Once the plyometrics are tolerated really well, then we start an interval throwing program, and that interval throwing program needs to be specific to your sport and also your position. So if you're a pitcher, you have a lot more work to do than if you're a first baseman, right? So it's a little bit different based on the sport, a little different based on the position. So now you're an expert in treating slap tears. The thing about slap tears is sometimes those folks present with anterior instability. And if that's the case, you probably need to tack on a couple additional exercises to deal with that anterior instability. Well, I have a video for you. I'll leave a link in the corner. Go go ahead and click on that. And I'll go over my favorite exercise for folks with shoulder instability to make your slap tear treatment program that much more robust. I'll see you there.